kind of have an interaction so we can get to know each other, which might not happen when we are kind of start doing our sessions. When it goes too intense, then we might not have the interaction. So therefore, I thought it was a good idea to kind of interact today. And if you can, you know, do that. So what we are going to talk about today is keeping things confidential, and showing respect to each other, turning up on time, and review the sessions if this is needed. So as Dr. Kumarendran was saying, maybe the teaching that you are used to in Sri Lanka is quite different than what we are doing here. We treat our students like our friends, and we have a very friendly kind of connection. And learning is two ways. You tell us what is going on for you, and we kind of collaboratively working with you to help you to understand your needs and then provide support according to that. Does that make sense? You can put your hands up by doing the reactions if this makes sense to you. Okay. So if you are here and present for the session, my question is, what are your goals and intentions of coming to this session? Basically, why are you here? And what motivated you to attend this session? And what do you hope to achieve from these sessions? So I would, either if you would like to type your answers, you can. Or if you want to unmute and speak, I'll welcome that. Okay, you can see the questions here. What are your goals and intentions? What motivated you to attend this session? What do you hope to achieve from the sessions? Can you type or can you speak? Take your time. I'm going to give you 5 minutes. So it will be silent until you respond. So it is simply, there are no right or wrong answers here. It's not an exam questions. It is about getting you to reflect on your goals and what your intentions of being here and what motivated you to attend this session and what do you hope to achieve from this session. Okay, so we have some responses in the chat. I love this. So Abhirami and Menaka, both are psychology lecturers. They are attending the session here. And we have the Nasika is saying, I just want to gain some knowledge to do my clinical psychiatry appointment. Okay, okay. So you have a purpose and intention of coming here, the Nasika. Anyone else? Otherwise, you will have to email this to me. It's up to you. You can share it here or you will have to email it to me because then I can plan my sessions. Okay. Abhirami is saying we want to get more out we want to get more about CBT from a CBT specialist. Oh, you would like to know more about CBT from a CBT specialist. Okay. So now we have Bhavana sharing. As a medical student, CBT is an important aspect. It is something I felt that we all should know. This course was highly recommended to me. Okay, that's wonderful to hear, Bhavana. And then we have Jadushan. I wanted to make lifestyle modifications. I really love this, Jadushan, because you are here because you would like to make some changes to your lifestyle, and that's really good to hear. So anyone else? Okay, so the reason why I'm asking here is it would be a waste of your time to attend this session if you have no clue why you are here. So what we need to think about is how I can meet your needs. Let me share this. I haven't been speaking about CBT to students, especially psychology students or undergraduates. Most of the people I see is they are highly qualified individuals. So they have already done their psychology degree, or they are doing their clinical psychology degree, and they would like to specialize in the field of cognitive behavioral psychotherapy. So the people I have been supervising, either they already have a profession where they are a psychiatrist, but they would like to do this course and specialize themselves. So that's how I kind of help them to kind of look at maybe anxiety and depressive disorders. And I also supervise in Sarai University, and all these students, they have done some form of profession. They have their core profession. They might be nurses, or they are already qualified in psychology field in some one way or the other, but they would like to do some specialized kind of training and to do CBT. So I supervise them, train them, and hear how they are doing in terms of their patients as well. You are very new to me, so you will have to teach me in terms of what you want. Also, you are from Sri Lanka, I'm from here, and there are cultural differences in terms of how you do work there and what you do with your patients. And if you are students, I have no idea whether you are seeing patients and whether you would be having chat with them in terms of understanding their problems and things like that. Maybe you are doing some form of training, maybe speaking to patients. I'm not sure. So these are the things I don't know about you, which would be lovely if you could interact with me and let me know. And it's very important for me to modify the course according to your needs, so I meet your needs. So when you attend a session, if you're unable to share a need, then I will not be able to meet your need. It's almost like you might be turning up to a bakery, and in the bakery, what do they sell? They sell bread. And you go and ask the bakery person, I would like to buy some makeup from you. And they would be going, what? Because you are in the wrong place. So if you don't understand your needs, and if you don't understand what you are doing, and certainly that it is very difficult for us to kind of start thinking about what you want. I hope I make sense. Do I make sense? Any reactions for that? Do I make sense to you by sharing what I just shared? Yes? No? You can put yes or no in the chat if this makes sense to you, what I just shared. Great. I'm really happy to see these responses. So it's very important in life, if you are interested in looking at psychology, that you understand your needs, your motivations, and what you want from this session. Aisha, it's really lovely to hear that you are here to promote your self-awareness regarding CBT and the aspects of this. So it's really lovely to listen to that. Okay, so now let's move on a little bit. And let's look at the other things. Okay. I'm having a little bit of difficulty with my slides. It's not moving. Okay. Oh, right. Let's look at it. For any form of whatever that you are doing, ethics is really important, isn't it? Our ethics and moral values and things like that. How do you understand ethics in your everyday life? I would like to have some answers. Either you can speak or you can type. It's totally up to you. I think you are feeling better with typing. So I would like to know, because you see, these are the things that's going to help me to understand you and how much you understand about these things. So I don't need to repeat to you, and you would be grateful if I don't repeat the things that you already know. So how do you understand ethics in your everyday life? Thank you, Gobika, for sharing that. You have put ethics are morals we are bound to. Yes, yes. And how do you understand in our everyday life? Let's say that you are students and you are coming to, speak to, are you working with patients, by the way? Are you kind of seeing for any form of practice? Maybe you wouldn't kind of doing it on, but okay, you do. So how do you understand that, Dhanashika, when you're interacting with patients, how do we make sense of that? Maybe ethics in your everyday life. Is there anything you can give us for an example in our everyday life? And it doesn't have to be patients. It could be the way you are interacting with the world. I'm very patient. I'll just wait for you to answer. Okay, so you do keep confidentiality. Well done. Respect for other people, justice, empathy. It's wonderful to hear, Aisha. So these are the things that you already know that I don't need to speak about. So you are giving me some clues how much you know, and I don't have to go deep into ethics. So why we may need to keep things confidentiality, respect people, and justice and empathy, which we are trying to do here as well, isn't it? That we are coming together as a group and we are kind of keeping this confidential, but you are going to give consent to recording. That is something that's going to happen. And also you are offering respect to people here, and certainly you are respecting me because when I am asking questions, you have started to type. That is giving me respect, and showing your enthusiasm and that you are keen to engage with me in conversation, and justice and empathy as well. So that's lovely to kind of have some answers there. Let's move on. Now, I'm going to tell you a story, and again, you will have to engage with me in here. So Peter was a patient, and he had an opportunity to speak to you about his presenting difficulties. He shares he is suffering from depression. He reports difficulties related to sleeping, concentration, and engaging in everyday activities. He also shares he ruminates a lot and feels like a failure. Furthermore, he reports suicidal ideation. Okay, that's the story. Now, you're a medical student or a psychology student, or you're lecturers here. I'm sorry, because I was not sure who are here. So anyway, so staff, students, psychology students, you are all present, and you are listening to and you listen to Peter's difficulties. Who is the expert on the problem? Okay, let's answer the first question. Who is the expert on problem? Go ahead, you can type. Who is the expert on the problem? You are now a medical student or psychology student. You are not fully qualified, and Peter is sharing some problems, and he's actually sharing he's suffering from depression. And remember, you're not fully qualified. You're just a medical student or psychology student. Who is the expert on the problem? Again, there are no right or wrong answer. This is not an exam question, so I would really like you to type. And guess what? I'm not going to read your names when you're typing, so you can just do that. Okay, thank you. Psychology student, CBT therapist. Is that me then? Am I the expert? Peter. Okay, there are different answers. Who else? Okay, I'm going to give you another 1 minute to the rest of you to type. Counsellors, psychologists, CBT therapist, Peter, therapist. I'm not going to read any of your names because it doesn't matter. A friend. I like your creativity. I like all your answers. Go on then. There are, okay. Okay. Yeah. So Peter, parents. Okay. That's it. Rest of you, you don't want to do it? It's fun. Come on, join us. Okay. So let's kind of move on then. Thank you so much for all of you. You are lovely people who responded this. Oh, Peter's soul. Oh, I love that. Peter. That's a wonderful answer. Influenced you and you thought, so maybe you are not be able to hear me now. Can you hear me? Because I know that my internet connection was a little bit off.
Yeah, now we can hear you.
Oh, thank you very much. So let's imagine after 10 years, because you met me for 10 sessions and I influenced you, you all thought psychology and psychiatry would be the best field, and therefore we are going to go in that direction. And after 10 years, you are becoming expert, or you're the doctor in your field, and you're highly praised with your patients. Everybody loves you. They think you are amazing. So Peter comes to you again, and he has same problems. He's suffering from similar problems. Who is the expert on the problem now? Try. So now let's hear your answer again. You're all fully qualified, famous in your field. So the question is, after 10 years have passed, yeah, and you are fully qualified, and you are kind of being a well-known doctor, psychiatrist. Peter has having same problem. And who is the expert on the problem? Okay, okay. So thank you for all your responses here. And okay, let me see that again. So one of you, okay. So the people who have said Peter is expert on the problem. So let's see that. Me. Okay. You are the expert on the problem. Okay. So I'm not going to read any of your names, but I think, could I say that those people who have answered to me, you are absolutely wonderful and lovely. And thank you for speaking to me. I feel good that you at least responded to my questions. So yes, it is Peter. Those people who said Peter is the expert on his problem, right? Because he knows what is going on for him. We don't. Whatever it is, whatever problem it is, patients, they are the expert on their problems, always. But we are here, we have some expertise, knowledge, methodologies, tools, research that we have. So we can certainly use that by listening to Peter to support Peter. But the problem, Peter is suffering the problem. He knows emotionally, cognitively, experientially, through his soul. Somebody said soul. So Peter kind of knows what he's suffering from, and he is expert on his problem. Does that make sense to you? Does that make sense to you? Could I hear some yes? Who is disagreeing with me? If you disagree with me, I would like you to type now. and tell me, Meera, you know what? You're totally wrong. I would like to hear that, somebody telling me I'm wrong, and explain your reasons. As I said, it's not an exam question, so you can do that if you want to. I'll give you a minute for that. Okay, so let's move on. So in terms of work, if you're seeing patients, some of you said you're seeing patients. So let's think about the ethical guidelines of CBT. CBT is accredited and looked after by BABCP. They have the ethical guidelines. So you are bound by some guidelines in Sri Lanka. In the UK, the BABCP profession, the organization, is what is regulating the therapist and whoever practicing that. And if you are doing something unethical, they come and say, okay, you can't practice anymore, that kind of thing. Okay, so they are regulating. And so I put patients because I wanted you to understand what we are talking about, service users. You might go, you're thinking, who is the service users? The service is what you are offering. Yeah, the service users are the people, patients who are making use of your service. So the idea is, in terms of ethics, you must act in the best interest of your service users. You must respect the confidentiality of service users. You must act within the limits of your knowledge, skills, and experience. If necessary, refer the matter to other practitioner who is better or well-versed in terms of that. You must communicate properly and effectively with the service users. So that means, you know, you must speak, communicate properly and effectively. So if you learn to communicate with me, you will be able to do that with your patients, right? Communication skills is very important to get history, and relationship is very important. Without relationship, nothing happens. If you cannot relate to someone and listen to them, it's very difficult for you to interact with the other person. So here is your opportunity to interact with me and speak to me. You must limit your work or stop practicing if your performance or judgment is affected by your health. So we have health issues, mental health difficulties, physical health difficulties. If you think, you know, you are not a superhuman being, you are just another human being. And if your performance or judgment is not happening, then certainly you must stop practicing. That means you might, you know, you must stop speaking to the patient because you are not the best person at that time. Are you the best person all the time? No, because we have limitations. So you must behave with honesty and integrity and make sure your behavior does not damage public's confidence in you or your practice. The public, the people who are going to come and see you. And if your behaviors is, you know, in such way, like, I know everything, I know your problem, let me treat you, you know, don't talk too much. If you say that to your patient, then you are wrong. And you might not be, you might not be the right person to see that patient or your client, however you call them. So that's very important. You must make sure any advertising you do is accurate. So whatever you are sharing, you're advertising about yourself, it's accurate and it's not wrong. For an example, if you're a medical professional, you're a medical professional, and you might want to tell your patients, I'm not well versed in terms of psychology, and I'm kind of listening to you to understand your problems, and I'm also learning from you. So that's something we do here. I don't know whether you do it over there, but you see the power dynamics. The power dynamics is certainly very important, is to kind of say, because when you are learned, when you think that you're an educated person, and people from different cultures look at different people different ways. Okay, so for an example, in Denmark, where I am coming from, the patient, doctors, or the patient, the psychologist, psychiatrist, whoever in that field, the relationship is very equal. And that sense that the patient can get annoyed with the doctor and say like, look, doctor, you're not doing well here. You're not understanding. Maybe I need to share a little bit more about me. That's because we are so equal in terms of the relationship. I don't know what you know about Denmark. We don't have any class. There is no hierarchy. In England, they have class and a little bit of a hierarchy. You have a high class, you have a low class, you have middle class and things like that. All unspoken, but it's there. I think in Sri Lanka, equivalent to that, you might have a caste system, or you might have rich, poor kind of differences. So diversity and differences are everywhere, isn't it? Or you might be coming from different backgrounds. I don't know. So there are differences, and there are differences in terms of people relating to people. However, when you are educated and you are powerful, you become powerful in certain countries. So people do look at you as a powerful person. In some countries, people do look at doctors as they know everything and they are gods or something like that. And they are the one who got the knowledge, which is not true. The patient got the knowledge. The patient knows the problem much better. But if you are good at listening, if you are good at kind of eliciting through the questioning methods, if you use your questioning method well, and the other thing is, if you get to understand your mental health issues, and if you understand your physical health, how your body is functioning experientially, which you can only learn through experience. And that is where here, when you are doing a psychology degree, all the psychologists, let's say counseling psychology, and all the counseling psychologists, they need to go to therapy. They need to kind of have therapy, and they need to come and show they have received 250 sessions of therapy, and they have worked through whatever issues they have. Because when you are going to work with other patients, so you have increased awareness. Okay, let me give you an example. Let's say that somebody is bringing honey to you, showing you the honey, and they are talking about the honey, the composition of that, the nitty-gritty of that, and how it is made, the chemicals of that, all the blah, 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 and everything else, okay? However, you have all the knowledge and you understand it, but unless you actually taste the honey and really experience it for yourself, you have no clue what it is. You will have some dry knowledge. Some people say that is garbage because, you know, what's the use of that? Some people say that. Some people say, well, that is useful because we make use of that knowledge to do something else. But some people say, actually, you know what? I'm not interested in learning about the honey. I would like to taste it. But what here in psychology field, you will learn about it and you taste it. So that is important. And you do that through getting to know yourself first. So whether it's in CBT, the things that I would be interested in you to apply maybe moving forward when we are talking about certain things is on you, because I wouldn't ask you to do this with your patients because first of all, you are ethically, you are not qualified. Secondly, the skills I'm going to offer to you is not actually enough for you to make use of to treat your patients. So first of all, I'm setting some boundaries here and your limitations. That is, you will not be able to treat patients using the knowledge I am giving to you today. However, you can make use of those skills to have some communication with your patients, but you can make use of those skills to increasingly understand who you are, what you are doing here in terms of your life or in terms of the profession that you are in and how you can understand yourself. Does that make sense? And please respond again by typing because I spoke a little bit now. Okay, so let me hear. Yes, yes, yes. Okay. And also those who are thinking, oh yeah, I like that hand, like thank you for thumbs up. And so anyone who says no, Meera, I am not agreeing with that. So put that there as well, because I would like to hear that. And again, I'm not going to mention your name, not to anyone. And you can say no to me. I constantly say no to, you know, when I was kind of a student and things like that, we have better interaction. I don't know in Sri Lanka how you are interacting with your teachers and professors, but here it's lovely interaction, and it's wonderful interaction. So okay, so it makes sense to you, and absolutely wonderful. And thank you so much for respecting me and responding to me. It's good to know that you are listening to me. Okay, so let's move on. Okay, what is emotional intelligence? I would like to hear a little bit about that. And yes, today you might not get to the CBT because it seems like we are doing it very slow, and I don't mind that. Okay, so what is emotional intelligence? Who knows that? And let's hear that. What is emotional intelligence? I think Ms Meera, I'm sorry, I'm not going to do your names properly. I think your mic is unmute and you are speaking, but I'm not sure whether you are speaking about emotional intelligence. Okay, so shall we kind of look at what is emotional intelligence? And I will be very happy to hear from you, Ms Meera, because you were already saying something. I didn't hear that. I'm not sure what you were saying. Okay, someone else, anyone else, please type again. What is emotional intelligence? What is EQ? It's called EQ. And again, please do know there are no right or wrong answers. And whatever you say is correct. And it's not an exam. Okay, oh, that's lovely. So let me read that. An ability to understand emotions of others and differentiate different emotions, ability to control our emotions, and emotional intelligence is knowledge to handle and express the emotion. Lovely. I think it is a capability of individuals to manage their emotions. Is that recognize our own emotions? Control and manage emotions in a good way. Okay, important skill in leadership and our emotions. Emotional intelligence can be identifying process of what emotions we are feeling. Okay, lovely. Seems like you are absolutely intelligent and you're giving me the right answers, all of you. So you see, now I don't have to speak about emotional intelligence. Seems like you are kind of well versed in this. Okay, let's hope that Google is not helping you. Okay, understanding different emotions. Okay, so now this is beautiful what you have just shared, but let's look at what it is and let's kind of talk about it a little bit. So there is emotions, intrapersonal emotions, which you have just talked about. So you have self-awareness, self-management, self-performance. So your self-awareness related to your cognitions, your emotions, and then self-management. Once you recognize your feelings, you manage yourself then using behaviors. Self-performance is what you are doing in terms of the work, leadership, whatever that's there. You have mentioned leadership. So that's self-performance. But when it comes to interpersonal, so intrapersonal, interpersonal, your emotions also help you to become aware of, have social awareness. Relationship management, this could be your relationship with your parents, siblings. And if you are married, partners and people's performance, how others are doing. So if you're a manager, you would be able to have that understanding. Okay, so CBT is kind of a tool to enhance people's or everybody's, maybe anyone's emotional intelligence as well. It's look at your cognitions, feelings, behaviors. But before moving on, let's kind of look at another definition. Emotional intelligence is the ability to identify our own emotions, those of others, to self-motivate ourselves, and know how to monitor our emotions and those of people around us. Okay? So perceiving emotions, understanding emotions, using your emotions, and managing your emotions. And if you don't know how you are feeling, would you be able to do that? No, I guess. Because it is important you come to know about that. And CBT can be a good kind of tool. So now we are talking about general communication skills when we are kind of speaking. And in relation to that, how do you communicate with your patients? I'm putting it here, but you could kind of tell me as well. So if you could type, what are the communication skills you use from here to communicate with your clients, your friends, your family? Yeah? Can you type again? So how do you communicate when you are communicating with other people? You could kind of use whatever that's here, but you could use your own words to type it there. So I'll give you some time for that. Or you could unmute and speak as well, if it's easier. It would be lovely to hear some of your voices, if you can do that. Yeah, yeah. So it's kind of, so thank you for sharing this. You are understanding different emotions and introducing yourself, verbal communication, asking questions, giving space to speak, establishing and maintaining good rapport, using open-ended questions, lovely, lovely answers, hearing, listening. Yes, it's very important, isn't it, to listen to other people. So thank you for really sharing this with me. So coming to here, kind of look at more, greet, listen, acknowledge, lovely, and then respect their words. Yes, when they are speaking, kind of listening and respecting, isn't it? That is very important. And also telling a summary of what I understand. That's very good. And probing. Thank you so much for that. It's lovely to understand different feelings. Yes. So it's kind of listening and probing and telling the summary, which is we kind of also kind of say paraphrasing and what you understand, because sometimes it happens, isn't it, when we are speaking to people. Have you ever had this kind of situation where you are speaking to your siblings and you say something, they say something, none of you listen to them, and you kind of start arguing and there was a conflict, and you are talking gibberish to each other, or I don't know, you don't understand each other. You are siblings though, but it happens, isn't it, with siblings, because we are so caught up with our emotions and we just don't kind of don't want to acknowledge their feelings, and we kind of fight for our feelings and they fight for their feelings, and they say something, we say something, and it's a conflict. Okay, so what you're saying is give them a confidence that we are fully engaged with them in their problems. Lovely. Clarification is very important. Thank you. Is it Jeevan? Clarification, exactly. So because sometimes we just listen and people will be just speaking and we don't clarify, we don't get it. So all these things that you have said is very important. So let's move on. Okay, so tell me a little bit about your culture, and I would like to understand that, because so then I know that you understand your culture. and you can speak to me about your culture. So again, you will have to type, because you see, I just spoke about I'm from Denmark and I moved to England. And well, obviously I was born in Sri Lanka. And if you would to kind of to speak about your culture, how would you kind of express that to me? So I was born in Sri Lanka. I was brought up in Denmark, which is quite different. And you can see that the interaction here is quite different when I'm speaking to you. Maybe, I don't know, maybe it's not. You are just being shy today, or but you are also responding by typing, so which I really like. So how would you express your kind of culture? So Krish, I will introduce to you later. You can unmute yourself, and I will, sorry, you can mute yourself, and I'll introduce you later once we come to the end of the course. Thank you. So can we have some answers in terms of how would you explain your culture to me? Because that's what I was trying to do throughout the session. How do you see yourself in terms of the Tamil culture where you have been growing up? I know it's very hard to kind of formulate that, but if you could say a little bit about your culture, some norms from your culture. I mean, we share similar culture because I'm a Tamil person as well. So I kind of know, but at the same time, you know, you might want to share something. So for an example, let me share from the Tamil culture that the food that we have here is very different, because we have different type of food, but in terms of the Tamil food, let me think of Tamil food. Okay, so my mom used to cook idiyappam for me. So that is the Tamil food, and that is different. What about you? So tell me a little bit about your culture. So you're communicating to me about who you are and your culture. Type, please. So maybe I'll just share Krishna. He's a senior lecturer from. He was a senior lecturer in the University of Surrey, and he's retired. And at times he said that he would come and cover some of the sessions. I will introduce him later. But let's kind of move on. Dress code. Thank you so much. Yeah, you dress differently, so that's a different cultural kind of way of being. Yeah. Anything else that you can think about? Okay. I will wait for you. I have lots of patience. Beliefs? Oh, thank you so much. Who is this? Madinathan? Thank you, Madinathan. Because beliefs are very, very important in terms of culture. People have different belief system. And somehow, you know, in terms of today, even there's lots of cultural differences are here, isn't it? Because I am the one who is speaking to you, and it seems like you find it difficult to unmute and speak back to me, which is quite different from the universities where I kind of interact with students. They say a lot more than me. And today I feel very tired because I am the one who is speaking a lot. Traditions, yeah, traits, celebrations, rituals, absolutely. That's really great, Aravindan and Menaka. And in general of Sri Lankan culture, we use lots of different spices. Yeah, I love spices too. So that's good. Language, cuisine, rituals, costumes, culture. Yeah, Abhirami, thank you so much. Myths and social relationships. Yeah. And how you are relating to people. Certainly. Okay. Thank you for that. Maybe that is good kind of for us to kind of know. Oh, okay. So there's more coming. High interaction with people, family bond, stigma. Yeah, definitely. Siva Sudha Sundaran. It is lovely that you were able to share something like stigma. It's very different to different cultures, isn't it? We stigmatize people, discriminate people, depending on where we are coming from, who we are, with our ethnicities, our culture, our language, everything. So there are diversity and differences and maybe inequalities. Okay, body language, yeah. Perhaps you might see I'm speaking in a different manner. I don't know. Yeah, so there might be difference. School system, exactly. Recently I heard that in Sri Lanka, racism, absolutely. Finding life partners. Oh, that's Krish. Krish, please do not cheat. I thought they were one of the students. So, okay. So in terms of schooling system, you are right. I recently heard that in Sri Lanka that they started they kind of stopped hitting the students, which happened long time ago here, isn't it? But in Sri Lanka they continued the practice and they used to hit the students, and now there's a law to kind of come and stop that, and then the teachers have no clue what to do. They don't know how to kind of teach the behaviors. Because what they knew was to punish, to stop people behaving in a particular way. So that's really wonderful to hear about the school system, finding partners. That's from Krish and Myths. Okay, thank you so much for that, everybody. And then we will kind of move on. Let's look at what I have said in terms of the culture. So the psychological processes influence culture, and culture influence psychological processes. Individual thoughts and actions influence cultural norms. So your thoughts, your actions, it does have a cultural, influence the cultural norms and practices as such as they evolve over time. And these cultural norms and practices influence the thoughts, action of individuals. So which is good. Okay. And thank you very much for your answers. You have been generous this time with me, and a lot of people were responding. So that is beautiful to see. Okay, so now we are going to speak very little about what is cognitive behavioral therapy, and I would like to hear it from you again, my dear students. You might be thinking, she's making us work hard. I'm telling you, I'm working hard. I'm speaking and I'm getting tired. So what is CBT? If you could write some answers for me from your understanding, what you know already. So I'll give you some time for this as well. Okay, there was something, okay. It is changed to negative thoughts. It is changed to negative thoughts, okay. Intervening thinking pattern. Yeah, that's lovely to hear from people. Negative thoughts make sense, thinking patterns making sense. Okay. Yeah, that's fine. Thank you, Krish, for coming in and just to show your face, because I just want to say, while we are speaking like here, Krish, as I said, he's the senior lecturer in Surrey University, and there is a possibility he might offer you some training in the future. And thank you for just coming and saying hello to us. And that's fine, Krish, you can leave anytime. Okay, so it's one kind of therapy is used to change thoughts and behavioral method. Thank you so much, Jeevan. Anyone else? You're talking about thoughts, you're talking about behaviors, identify and change destructive thoughts, bringing thoughts and emotion under cognitive control. Interesting. It is related with higher mental processes and action. Okay. Okay, so some lovely answers here coming up in terms of what CBT is. Why don't we figure out what it is later on? And let's just think about this now, okay? So let's look at an event. Now, a friend walks past without acknowledging you, okay? You are all, you are having a really lovely, great day, and this friend kind of walks past without acknowledging you. And your interpretation of your thought, maybe, if you could write that to me. Let's say that, you are having a lovely day, you're coming out, and it's a lovely day, right? You are having really, you are feeling good. Everything is beautiful. Maybe, you got some money from your parents, so you could go for shopping or something, and you're coming out and you're feeling really amazing. And then, suddenly this friend of yours walked past without acknowledging you. Tell me about your thoughts and your feelings. Either you can tell me by unmuting, or you can type. Just give me your thoughts and your emotions, then we can talk about it. You are feeling amazingly well. It's a lovely day. Well, it's a lovely day every day in Sri Lanka, isn't it? It's not cold. You have the sunny days. We don't have that like that. So we have good days and bad days because of the weather. But yeah, so let's look at it. Okay, so Tanasika, it's really lovely. Thank you so much. I'm going to write this down. He may be busy with some other thoughts. So Tanasika, if you have that thought, he's busy, how would that make you feel? Already shown. Yes, that's okay. That's fine. It's there. But I'm asking about your thoughts. Your thoughts. Let's say that's my thought. Okay, worried. Dushajini, you are saying that friend walks past without acknowledging you and you feel worried. Okay. Really sad. That's Tanasika. Again, he may be busy with some other thoughts and you feel sad about it. Okay. So I'm writing this down as well. I'm taking all this down so we can understand different people. It's related to, okay, sorry, let me see. I couldn't get the last one. Different people, different concerns, a talk for later. So certainly Siva Sundaran is kind of saying, oh, different people, different concerns. And it seems like he has something, he might have something in her mind, have to talk to her. So Abhirami certainly is concerned, it seems like, because she's kind of thinking, I need to speak to her. Okay, that's lovely. Could I have some responses for you are having very, very bad day. You had an argument with one of your parents or your siblings or one of your teachers who kind of really annoyed you and said you didn't do well in terms of your lectures, or I don't know, your parents were saying like, why didn't you tidy up? Something like that. And you are feeling absolutely worse and you are not feeling good. And how would that make you feel? And when they do that, the friend walk past and without acknowledging you, it's the same thing. How would you, so you are feeling, you are not in good mood. The first scenario was you are in good mood and your friend is walking past and you are worried, you are feeling sad for them, and you are thinking about them, but now you are very, very upset. How do you think that, what would go through your mind when they kind of walk past without acknowledging you? Anyone else? May feel he or she ignored me. Okay, that's really wonderful to hear that. Yes, because our feelings have an impact, isn't it? The way we think. So when we are upset, the whole world looks like that, you know, they are not taking any concern of us. So that's really well done, Dhanasika, for kind of saying we might feel differently. We might not have that concern. We might just feel they ignored me. And if they ignored us, how would that make us feel? Bad, right? Like, you know, well, feel disappointed. Okay, yes. Even more kind of feeling disappointment and things like that. Okay, so that is giving you an idea to introduction to CBT, and which is really good. Thank you for sharing that. Okay, so I'm going to move this into the corner and let's see. So now I'm going to give you a situation. Let's say that you are all kind of finished your degrees and things like that, and you're looking for a jobs online. And let me say it's me then. Okay, looking for jobs online. When my computer stops working, how would we think? This is hopeless, nothing ever goes right. What's the point in me even trying? That's because I'm looking for a job, because I don't have a job. I don't have any payments monthly. So obviously I'm not feeling great, am I? And then that's what would go through my mind. And the behavior is throw the computer, go back to bed or cry or things like that. So the behavior is kind of behaving in a particular way that's not helpful to us. And the bodily sensations may be heavy, feeling in chest. If you're acknowledging when you are feeling upset, that's what you would be feeling. Emotion would be angry, sad, deflated, anxious. So angry might be, where is that coming from? Nothing ever goes right for me. That might be anger. This is hopeless. That could be sad. What's the point in me trying everything? Or what's the point in me even trying? That kind of makes us feel deflated, isn't it? And certainly, so you can see some thoughts are linking particularly to particular emotions. I don't know whether in terms of the Tamil language, how you are kind of doing that, because we are going to move on to the Tamil language as well, because I assume that you are all Tamils. And then the body sensations would be like heavy feelings. So it is the way you are going to kind of experience your feelings. The way you feel and think will have an impact on your body, how the body behaves, and motivation and things like that. So certainly if you are having thoughts such as things are hopeless, you are not feeling great, you are feeling sad, the body is not going to feel great, does it? And you are not going to, your behavior is not going to be great. If you're feeling so angry, you know, you just want to kind of throw things. So the way thought have an impact on our feelings, our body sensations, guide us to behave in a particular way. So CBT is looking at thoughts, feelings, behaviors, and bodily sensations, and how this make us to behave in a particular way. Behaviors can be covert, overt. So internal behaviors is, somebody mentioned today, worrying. Worrying is a behavior. We are constantly worrying. Ruminating can be a behavior. Ruminating is thinking about the past and just sitting and spending lots of time doing that. Do you remember doing that when you're studying? You don't feel like studying and you're just thinking and thinking and thinking and worrying about certain things. And that is, you might have spent 1 or 2 hours doing that and you think, what had happened? How did I lose this time? So the internal behaviors such as worrying, rumination, which is, people cannot see that externally because that's taking place internally. And the behaviors such as when you are kind of going through this stress, you don't feel like studying and things like that. Procrastination, then, that's a behavior. And you can look at it. You can avoiding to write down things. You are not reading. So that is externally we can observe. You can observe as well. So understanding and identifying using first the 5 areas: situation, thoughts, behavior, bodily sensation, emotions, and how So how you are kind of doing this is important to kind of look at the links. Okay, so what is CBT? So cognitive behavioral psychotherapy or cognitive behavioral therapies, or CBT, are a range of talking therapies based on the theory that thoughts, feelings, what we do, how our body feels are all connected. We change one of these, we can alter the others. When people feel worried or distressed, we often fall into patterns of thinking and responding, which can worsen how we feel. CBT works to us, CBT works to help us notice and change problematic thinking styles. So if we have a problematic thinking styles, it will help us to change the way we think and the behavior patterns so we can feel better. So CBT has lots of strategies, like we have lots of methodologies, we have lots of problem solving techniques that's going to help us in the here and now. We don't talk about the past in CBT. We do. When we are getting history, we say, all right, tell us about what happened in the past, what was going on in the past, and how do you think that problem is contributing to what is happening in the here and now. So CBT is a here and now therapy, rather than, we don't dig too much into the past. We don't work with the past like the psychoanalysts. We work in the here and now, and we look at how thoughts link with the feelings and the bodily sensation, and how this is making us behave in a particular way. Is this clear? Could I hear some responses? Did you understand that bit? Okay. Okay, so it's really lovely to hear that. It's really lovely to hear that you can do that. Could I give you 5 minutes now to do a situation where you felt angry, distressed, and how you are kind of managed that. So we are not going to kind of work on that, but what we are going to do is we are going to a situation, very, very simple situation you have experienced in the past 2 weeks, and don't make it an intense situation. Let it be a simple, small argument with your sibling, or let it be an encounter with your professors, your lecturers at the university, where you didn't feel good about it. You felt slightly upset about it, angry about it. It could be your parent, it could be your friend, and I'm not asking you to show what you're doing, but I'm going to give you 5 minutes to write down the situation. So when you're going to write down the situation, you are going to put situation, me speaking to my sibling on last Saturday at this time. Thoughts, she's not listening to me, she's not hearing me, maybe. Feelings, how is that kind of linking with your feelings? What feelings was that? She's not really listening to me, could be feeling sad or angry. And then how did you feel in the body? And how did you behave with her? Did you shout back at her? Or did you leave? Didn't you say anything? Or did you withdraw? Did you go quiet? That's a simple example, but I would like you to do it for yourself so you can understand your thought processes and become aware of how you react in certain situations. Okay? So if you are there writing in English, I will highly encourage you. If you are, I don't know, you might be, you might be Tamil speaking students or Sinhalese speaking students or different language speaking students. I don't know. But if you are, if you can do it in your own language, that is much, much better. The reason why I am saying this is your feelings are much better expressed in your own language. I certainly didn't realize that there are, there are other students here as well. So if you would like to kind of do it in your language, that's much better, because any expressions expressed, feelings expressed in your language is much better. That gets you to connect a little bit more than a secondary language. So when you are writing this, situation, thoughts, feelings, behavior. Sorry, I didn't have it in Sinhalese, but certainly if there are Tamil students, you can look at this. So you can put சூழ்நிலை, எண்ணங்கள், உணர்வுகள், உடல் அறிகுறிகள், செயல்பாடு. For those that have different language, apologies. I'll try to make that included in my next kind of session. Or I will just keep it in English, so we kind of keep it in English. But it's just I am kind of stressing the importance of writing it in your own language. So certainly, please do it in your own language when you are writing it down. If you're writing down in English, that's fine as well. So as we are nicely coming to the end of this session, we have 3 minutes left. Continue to write that, and would you like to share your experience of doing that? If you have completed doing that, would you like to type it here? Because that is what we call a simple cognitive formulation. Amazing, amazing, Sureksha. I love this. I would like to really like to read this out. And I think when I was a student, I was feeling frustrated like this as well. So the faculty plan to have a number of practice sessions at the beginning after the prolonged vacation. Thoughts. Don't they understand student situation? That's the question, Sureksha. And, rather than asking this as a question, let's make it as a statement. They don't understand students' situations. So that is what it is coming up for you. They don't understand student situation, feeling unhappy, stressed, hopeless. So when we are feeling stressed, what happened? We feel lots of stress hormones being released. The body is not feeling great. So how would that make us behave? Certainly, you don't want, would you, at that situation? You angry as well. So unhappy, stress, hopeless. How would that make us behave, Sureksha? If you would like to answer, but anyone can answer. How would that make you behave when you are feeling unhappy, stress, and hopeless, please? Unproductive, exactly. We are not going to do things, are we? What would we be doing? This is for every student. This is amazing that one of the students shared this situation. Why don't we kind of think about it and really answer that, because this is really applicable to all of you. So unproductive, give up. Exactly. You don't want to kind of engage in to do these studies, isn't it? Because it's so stressful, and we feel hopeless. And what we are going to do is we are going to look at what stress is next time. So this is good that you are talking about this. Please do type. This is your chance, because we are coming to the end of the session. Demotivated, certainly in the body, when we are feeling demotivated, we don't want to do anything. We would procrastinating, uncomfortable to do anything. Absolutely. We don't even want to do pleasurable activities. What we do is perhaps we would be sitting in one place, not wanting to do anything, and that could be it, isn't it? Okay, so absolutely sorry. Wonderful situations, so we can behavior kind of situation here. Demotivated, worrying and anxiety. Yep, that's it. So when you're going through these thoughts that they don't have, they didn't plan this well, did they? And then, you are ending up feeling so stressed and anxiety and things like that. What do you do then? I would like to hear, what do you do? Do you speak back? Maybe your culture might not allow you to speak back and tell the lecturers and the university what is going on is really stressful for us. Can you ensure that you make, you make clear planning related to this? But because you are not even speaking to me here, so I assume you wouldn't speak back. And so what else would you be doing? So let's hear some behavior. We understand the feelings. How would you be behaving? Would you like to put it here, your behaviors? Avoiding, not speaking back, maybe? Am I wrong? Or do you share your concerns? Okay, maybe sharing your feelings with closed people. Will that problem solve? Complaining? Okay, you can complaining to people and say, oh yeah, this is happening. And this happens, isn't it, that we complain? Attend the session just for attendance. Is that what you are doing with me as well? Yes, exactly. That is what happens, isn't it? Then we don't learn. And when we don't learn, we are not productive. And we are not productive. We kind of the long-term goal. Okay, so well, I do need to pass out, and therefore I need to kind of look into my long-term goal, and I need to do something or something. Okay, so it's amazing what you are coming up with. So your behavior is attending the session for the sake of attending, complaining, and remembering the wrong long-term goal. But will the problem get resolved then? So there's nothing here that's resolving any problems, do we? Because we are going into the vicious cycle, which is lovely what you have put. So I'm going to kind of make take a thing. The situation is having number of practice sessions at the beginning. I'm repeating this again, and after a long vacation, and then the thoughts are like, they don't understand the student situation, feeling unhappy, stressed, and hopeless. And what is happening as a result of this is your behavior is that you are only talking to people who are close to you, you are complaining, you are just attending the sessions for the sake of it, and you are just kind of, then other cognitions are coming in, remembering long-term goal. So could I ask another question before we come to an end? Will this resolve the problem, or are we in the vicious cycle? We are now in the vicious cycle, isn't it? We are repeating ourselves, and we are getting caught in this vicious cycle, which we are going to talk about next week. Okay, so thank you, students, for kind of responding and to this. And you are coming to see me on a Sunday. And that's why, like, hopefully that you are all happy to come and see me here. So we looked at your vicious cycle, and maybe you might want to kind of practice the areas, which is the 5 areas you have learned today. And that is what we are going to build on. And when we are going to build on those 5 areas, we want you to understand really what is it, how is it for you. Then we can look at the depressive disorders, anxiety disorders, because then we are going to formulate more. This is called simple formulation. You are formulating a situation here, and then we will be kind of looking at other problems. But this formulation is so lovely today, what you have shared, and I think you have absolutely good understanding of that. So if you have any question, we can talk about it. Date of the training, I'll confirm this to you. Let's kind of keep next 3 dates, which is the September month. I can confirm you that now, and then we will review then, and I will let you know the dates for October. Possibly we will just continue like that, but if we need to take a break, we will do that. We will talk to each other and arrange that. Okay. So please call me Meera. Please do not call me ma'am. I feel really strange when you're calling me that. We always call each other with the first name. So please call me Meera. And thank you so much. And I hope you have enjoyed the session and you are not here for the sake of being here. And we are going to learn a lot. And you know what? I am going to ask you to speak more next week, unmute perhaps, then we can have a conversation. So thank you so much. Nandri, Vanakkam.
Thank you, Meera. Very valuable time here. I hope all of us had a good session today. So looking forward to the next session next week. Thank you.
Thank you. I think it's Shambhavi who's speaking. Thank you, Shambhavi.
Yeah.
And you can say we can end the session now.
Right.
Okay.
Okay.
Thank you.